This last part of the online lecture about substance-related and other addictive disorders is all about treatment. And overall, there has been a lot of research on treatment for substance use disorders, leading to the establishment of many different evidence-based treatments. So we'll go through these one at a time. First are 12-step programs, and these programs were started in 1939 by Bill Wilson and Dr. Bob Smith. 2014 estimates suggest that there are about 2.1 million AA members worldwide, with about 1.4 million of those in the US and Canada. And these programs are founded on 12 steps that center around these core ideas. So admitting one cannot control one's addiction or compulsion, recognizing a higher power that can give strength, examining past errors with the help of a sponsor, making amends for these errors, learning to live a new life with a new code of behavior, and helping others who suffer from the same addictions or compulsions. Overall, 12-step programs are the most commonly prescribed treatment for substance abuse, particularly for alcohol, and people are often mandated to attend through court orders, parole, etc. But the effectiveness is extremely variable. So some studies show actually pretty poor outcomes, with nearly half of attendees dropping out within the first year, and even more than that relapsing. But other studies show comparable outcomes to other treatments. So just how substance use itself varies substantially from one person to the next, so too does the effectiveness of treatment. Next, considerable work has been done that suggests that treatment for substance use disorders, and actually for all disorders for that matter, depends on where the person is at in terms of their readiness for change. And Prochaska and DiClemente devised a stages of change model, which tries to make sense of where people are at in terms of their preparation for change, acknowledging that if a person isn't actually ready for change, then there's literally nothing you can do as a family member, friend, or even professional to make them change their behavior. More recently, pharmacotherapy has also become a fairly common treatment for substance use disorders. In particular, two types of pharmacotherapy are often used to treat substance use disorders. Agonists, which are chemicals that have similar effects on receptor sites as a substance, so methadone would be an example of this, or antagonists, which work by blocking receptor sites, so even if the person ingests the substance, they won't have the same physiological effect. So an example of this is buprenorphine, which is used to block the effects of opioids. In terms of psychotherapy, cognitive behavioral therapy and motivational interviewing, which is a type of CBT, have both been shown to be effective. So CBT, as we've previously discussed, involves identifying thoughts and feelings or triggers that precipitate substance use, developing alternative coping mechanisms, and preventing relapse. If clients are earlier in terms of their readiness for change, motivational interviewing has also been found to be effective in increasing client motivation for change by letting the client come up with not just disadvantages, but also advantages of continued substance use. And the premise is that if you can go with the resistance of the client rather than fighting against it. So if I, as a practitioner, can kind of hold off on telling my client that substance use is all bad, then the client will actually be able to come up with their own reasons for discontinuing use, or at least will be more open to considering change. Contingency management is when clients are incentivized for abstaining. So you essentially provide a consequence that's more desirable than the physiological effects of the substance. Now, this is pretty controversial, in part because for a lot of people, there's little that's more reinforcing than the substance itself. But this approach has been shown to be effective in some cases. And finally is the family systems approach, which is a pretty big departure from these other approaches that are individualistic in orientation. According to family systems theory, substance use is the result of issues within the system. So based on this perspective, treatment involves the entire system or family, identifying where the problems lie and then rebalancing the system so the substance use can discontinue. So those are the evidence-based treatments for substance use. If you have any questions, make sure you're posting them on the discussion board. Now go ahead and take the quiz on Canvas.